Is your thyroid function affecting your hormonal health and fertility? Well, today I'm talking with Dr. Valerie Getings, and we're going to be talking about just that. I'm your host, Dr. Miranda Naylor. I'm a board certified functional medicine doctor and women's reproductive specialist. And it's my goal to help women to understand their bodies and to really feel empowered in their wellness. Today, I'm so excited to have Dr. Valerie Getings as my guest. She is a naturopathic doctor who specializes in thyroid function and gut health. So welcome, Valerie. I'm so happy to have you here.
Thank you so much. I'm so excited to be here.
I would love for you to introduce yourself in a little bit more detail and really tell the listener what you do, kind of a little bit about your background.
Yeah, so hi, I'm Dr. Valerie Getings. I'm a licensed naturopathic doctor in Arizona. So I have a private practice in Scottsdale, Arizona, where I treat high-performing women with gut and thyroid conditions. In my previous life, I was an award-winning journalist and worked for Navy Medicine, which as a public affairs specialist and program analyst, which really shaped the way that I look at the body as a whole. So I'm very much systems oriented and really focus on kind of getting to the root cause of what's going on in somebody's health.
That's so fascinating. How did you get into what you do now, into naturopathic medicine and particularly specializing in thyroid and gut health?
I was having 60 to 80 seizures a day and was overdosed on my seizure meds by my doctor. And then finally found a traditional naturopath, and she changed my diet, changed supplements, changed all of these things. And then within 8 months, I stopped having seizures. So that's what got me into naturopathic medicine. And then when it comes to gut and thyroid health, I always had gut issues growing up. They told my mom that my stomach wasn't fully developed till I was two. And I just would get sick all the time and like throw up when I was little. And I had, upper GIs, lower GIs, swallowing barium, doing all of the things. And they couldn't really figure out what was going on with me. When I got into college or med school, I was having a lot of thyroid issues, and it was noticed by another physician who was like, take some desiccated thyroid. And I just had a miraculous experience taking it. I was like, oh my gosh, I was like, the trees are brighter. I can see clearer. Like my tongue is half the size because I had like swelling tongue as a result of thyroid. So yeah, lots,
Had quite the
lots,
journey.
quite the
Yeah.
journey. Yeah.
I feel like that makes us such a good practitioner then to be able to really understand what a patient is going through and really speak from experience and just
Yes.
feel so passionate about what you do. That's amazing.
1,000%. Yeah.
Yeah. Well, wonderful. Well, I'd love to jump into things. I think in functional medicine and naturopathic medicine, we know very clearly how important our gut health is with our overall health. I mean, you experienced that personally.
Mhm.
But I think a lot of people don't always see the clear connection of how our gut symptoms or, our gut function in general, even if we're not having symptoms, can affect our overall health. So I'd love to hear how does our gut health impact our overall health and our hormones?
Yeah, so our gut health plays a massive, massive role in how we function, in our health, overall health, and then definitely, like you mentioned, in our hormones. So our gut health, we like that's how we process food and absorb nutrients. So when our gut health is off, it can lead to nutrient deficiencies. It can lead to the first thing that people would probably notice is a lot of gas, a lot of bloating. But that's not always true. So you can have an imbalance, but still not have massive, massive symptoms, which is really interesting for people. Other ways it manifests is brain fog, just really feeling tired, just non-functional. A lot of people kind of classify it that way. And then when it comes to the gut and thyroid, the reason I started focusing on this is because you get 20% of your thyroid hormones from your gut. So if your gut's not functioning, your thyroid will tank as well. And then when it comes to the rest of the hormones, if you are not processing fats properly, fats are kind of the little school buses that take all of the hormones around the body. So if you're not processing fats properly or you're not intaking fats properly, then a lot of your other hormones will be affected.
Yeah, that's such a great visual. And I think that's really important for a lot of people to hear because we still have a lot of fear around fats in our diet often.
Oh yeah.
And so that's great to hear how important that really is and even just how we're able to absorb those. What would be some
Yeah.
other, you mentioned we don't always have very clear signs. I mean, I think bloating and, having diarrhea and things like that, we're like, okay, there's clearly an issue here, but what would be
Yeah.
maybe more subtle signs? You're talking about some of them, but what would be the more subtle signs that you see a lot in women?
More subtle signs are all of a sudden if they try a probiotic and they just bloat like crazy and they're like, what is going on? That's typically a sign that they have some small intestinal bacterial overgrowth or SIBO going on. Um, that or skin issues is another one. They'll be like, oh, my gut is fine, but I'm having these weird rashes. That's
Mhm.
typically from high staph and high strep. So those, again, brain fog, just really like tiredness and things like that. So those are kind of some of the keynotes for gut issues.
Yeah, great. Yeah,
Mm,
there's ones that I see all the time. And again, a lot of people aren't necessarily clued into them unless they're really disrupting their life. So
right.
it's really good to have on our radar, especially if we're having some of those other symptoms. Um,
Yeah, because I was gonna say with the skin issues, it's really interesting because a lot of people don't tie that to the gut. But again, if it's actually I found there's like three strains that will affect people. So it's like high staph and high strep, and then high fusobacterium as well will cause like a lot of eczema. So it's really interesting to kind of see that connection for people when they're like, oh, I'm just supposed to go to my dermatologist or supposed to go to like get another product, right, to get rid of that rash, but it's actually coming from the gut.
yeah,
So,
absolutely. It's so powerful. And, something that I see a lot too, especially lately for some reason, is like histamine being an issue.
hmm.
So kind of, similar to having rashes, but it can look a little bit different, right? We can be having all these like histamine or allergy responses sometimes. And that can also come from the gut microbiome, right?
A thousand percent. So there's it's coming from a few places. So it's either coming from the gut microbiome where you're having certain species that are histamine producers.
Mhm.
So this is where people may think, okay, you may think like, oh, I just have to go get a Benadryl or an allergy thing. They may not make the gut connection, but again, it's just a lot of bacteria that are histamine producers. So there's that. And then also there's certain there's like three main chemical pathways when it comes to histamine. So sometimes what's happened is that the pathways are kind of gunked up. So you
Mhm.
need certain cofactors to help clear those pathways. So those are kind of some of the things that are going on there. But yeah, I
Yeah.
see that a lot. So people are like allergies or itching. They're like all of a sudden reacting to everything and a lot of histamine, which I'm sure you see as well.
Yeah, yeah, and especially when maybe their primary concern is perimenopause, and their
Mm,
estrogens are going high, and that's one thing that I find so fascinating is that our estrogens and histamine levels are also tied together, and
hmm.
so they can really clearly like one makes the other worse, that makes the other one worse, and then they can become like this perfect storm of all sorts of symptoms that they're having, like digestive symptoms and the rashes and allergy symptoms, and then also maybe the high estrogen symptoms as well. So like tender breasts and stuff like that.
And
Um,
I think those kind of that cluster of symptoms that you mentioned is really, really challenging for patients because typically in conventional care, the systems are all separated. So when you're having those symptoms, like who do you go to, right? Like, do you go to an allergist? Do you go to an ENT when it's actually either gut, or do you go to your OBGYN and tell them this, right? Like, who do you go to? So I think that's kind of the confusing piece for a lot of patients.
yeah, so confusing because then they end up feeling dismissed by all of the specialists because all the specialists don't really know how things are tied together. Yeah, absolutely.
Right.
Well, I'd love to hear a little bit more about thyroid function as well and how, you kind of mentioned that connection together. How is the thyroid then tied with the gut, beyond like the thyroid being so important, or I'm sorry, the gut being so important with the conversion of the thyroid hormones?
Yeah, so the again, like you get 20% of your thyroid hormone from your gut, so it's important that that is functioning. And in addition to that, there are certain gut bacteria that support or can cause a lot of issues with thyroid conditions like Hashimoto's thyroiditis. So we
Mhm.
look at certain strains to figure out is it helpful, is it harmful, like what is going on. Um, And then if there's also a lot of inflammation in the gut, then this throws off the immune system in the gut. So that can also worsen things like increased antibodies in Hashimoto's thyroiditis.
Mhm. Yeah, absolutely.
Yeah.
And with symptoms too, I get, with the thyroid symptoms, I feel like those are maybe a little bit more widely talked about with people. They're gaining
Mhm.
weight, for example. People be like, I want to check my thyroid, I'm gaining weight. But what would be some other signs of thyroid dysfunction that people might not be aware of?
Yeah, so we would look at how their hair is presenting. So if they're having dry hair, their hair is falling out, we would look at those symptoms. Another really interesting one is swollen tongue or issues speaking. So I had that. So when we are like in the womb, um, the tissue from the tongue and the thyroid is the same tissue. So therefore, we have to like look at if the tongue is swelling, then they say it's like an increase of toxins, accumulating kind of like in that space, but also related to thyroid. So again, if the thyroid is off, then you're going to have these like sometimes your tongue is very, very big or swollen. That can be a thing. And then also having issues with cold intolerance or heat intolerance. So a lot of people have I live in Arizona, so a lot of people have thyroid issues. They love the heat because they're cold all the time.
Mhm.
Or with hyperthyroidism, they are hot, hot, hot. So they have a heat intolerance. They don't like to be in the heat. But one thing that the thyroid does love is heat. So we often recommend sauna for the thyroid because it loves heat.
Oh, that's fascinating. And would
Yeah.
that be any thyroid dysfunction or, low thyroid function in general?
Most likely low thyroid function because the people who have hyperthyroid, they're gonna be heat intolerant, so they're not gonna like that as much. They could
Mhm.
probably do like lower amounts of sauna, like 5, 10 minutes, but yeah, so mainly hypothyroid.
Okay. And how about for autoimmune? Is that still the case that would be safe for them to do?
Yes.
Great.
Yep. So for Hashimoto's still doing sauna and sweating, getting like all of those toxins out, getting mycotoxins out would be really helpful.
Yeah, yeah. And since you bring that up, what is the connection, how do toxins play into thyroid dysfunction?
Yeah, so many, many different ways. Because I was thinking of mold as a toxin. So that can wreak havoc on thyroid function. So when it's interesting that you bring that up because when we're looking at labs, like things are not so straightforward. So when we're looking at things like mold or heavy metals or xenoestrogens and toxins, all of those can throw off thyroid function. So we have to look at not only what the numbers are saying, but kind of the picture around it. Like what else is at play that can be making these numbers kind of thrown off. So
Yeah.
typically what you'll see is um, issues with T4 to T3 conversion. So T4 is inactive, T3 is the active thyroid hormone. So you'll see like low T3, free T3. So you'll see that a lot, or TSH can be off. But again, you have to figure out like, does a person have a whole lot of toxins in their system? And we would use something like a mycotoxins test or something called an OAT test,
Mhm.
organic acids test, to kind of see those pathways to see, how how many toxins are really like in the body. Is the person able to like get rid of them or not?
Mhm. Yeah, I think that's so important because so often, right, the conventional approach is, oh, your TSH, like they might not even check anything beyond TSH. Your TSH is
Right.
low. And it has to be really low to do anything about it oftentimes, or I
Yeah.
should say, I'm sorry, high. Their thyroid function is low, their TSH is
Yeah.
high, and they get a medication and it's like, go on your way. And so many people maybe don't feel good still. They're still like, they know they're not feeling the way that they want to. And so I love that you're taking that more global approach to look at the whole pathway of the thyroid hormones and looking at, okay, what is the root cause and what is actually causing the thyroid to not be working well. Uh,
Yeah. And in that, like, I question a bit further, like, are they living in Glade plugins? Like, are they living, are they surrounding their home with just a lot of toxic chemicals? What are their beauty products like? And then
Mhm.
another thing that we look at a lot is iodine. So for thyroid, a lot of people believe that you have to have a lot of iodine to supplement, fix the thyroid, which is actually not true. The more iodine that you have, the more the thyroid will tank. So you
Mhm.
only need like 125 micrograms per day. And we get a lot of that from our iodized food, iodized salt. So for people going overboard with all of those things, then the thyroid is also going to tank. So we look at everything.
Yeah, yeah, that's a good important point to bring up with the iodine. I
Hmm.
see with my population, a lot of people are not getting a lot of iodine sources. For people who are more health conscious and maybe avoiding dairy, maybe avoiding iodized salt, or they're using like sea salt or things like that. And so I'll see people actually low in iodine, and then it is, what I always say is that the Goldilocks nutrient, right? We don't want too
Oh
much, we don't
yeah.
want too little, because either of those could cause a lot of problems. And so you're right, having a good moderate amount of it every day can be really important for that.
Right. But then also I was gonna say looking in like to lotions, because I know like seaweed things are like a huge trend now. So if you're having any kind of sea minerals or whatnot that are in lotions, people are absorbing all of that. So we have to kind of keep an eye on that as well.
Yeah,
Yeah.
that's so interesting. They could be overdosing on iodine without having any awareness of it.
Yeah.
And you're right, like, all of those products, I think it's so important to look at. That's something that we're talking about in fertility a lot too, is that all of those, estrogens, all of those toxins can pile up and cause a lot of issues with our hormonal health and reproductive health, as well as our
Hmm.
thyroid. So, what other nutrients are really important for you to look at, either in testing or, in talking with someone about their diet for thyroid?
Oh, for thyroid. So I would see obviously where their iodine is at. I would also look at selenium, magnesium. Those are kind of like the main ones that I would look at so far. I use like a lot of complex products that also have like black seed oil that help. It also depends on whether like what thyroid condition they have. Do they have hypothyroidism? Do they have Hashimoto's? Because we treat those a bit differently. And there's also a huge for with selenium, we always recommend supplementing versus taking Brazil nuts. Because
Mhm.
with Brazil nuts, you can't really tell how much selenium is in them and it varies and things like that. So we
Mhm.
always recommend supplementing if necessary.
Yeah, that's great to know. Yeah. And for people who don't know, basically because Brazil nuts are really high in selenium.
Yeah.
Uh, so yeah, that's great to know. All right. And with that too, to kind of go back to the gut health and thyroid, then especially maybe in particular with Hashimoto's, what would be your approach there, or how would that differ?
Yeah, so for Hashimoto's, it's different because we want to see first where the antibodies are at. So if you're having antibodies in the thousands, then obviously that's clinically significant. Antibodies that are in the double digits, like the low double digits, are not necessarily clinically significant. They can just be there without causing havoc. But when you're having very high antibodies, that is very different than treating hypothyroidism. So then we would look at selenium, black seed oil, and then also just, again, seeing where the person's iodine is. There's some great products by Dr. Alan Christensen that I love using because all of his are based on research. So when I use those products for Hashimoto's, it like brings their antibodies down by half. It's
Mhm.
incredible, incredible. And then joint pain goes away, body aches and just fatigue and all of that stuff just seems to go away very, very quickly.
Awesome.
Yeah.
Yeah. And as far as looking at the gut and maybe like with food sensitivities and things like that, how do you approach that? Like looking at their gut health then when they have Hashimoto's as well?
Yeah, I'm glad that you brought that up with food sensitivities because so many people just jump into the food sensitivity test while they're having a lot of inflammation. So what
Mhm.
happens is that the food sensitivity test is kind of like throwing money out the window because you can't do a test when you're literally reacting to everything.
Mhm.
So what we do first is I have my Gettings gut health method where I take people through a whole process where we work on the gut first, then hormones, nervous system, and then energy systems. And then by about 3 to 4 months after we've worked on the gut, then we do a food sensitivity test. Then
Mm.
it can be accurate to actually see once their gut has healed what they're actually reacting to. So sometimes we find people reacting to with Hashimoto's. And Dr. Isabella Wentz talks about this a lot. She's
Mm.
amazing. Like soy, gluten, and dairy are the main ones. So people have really interesting reactions to those.
Yeah. So do you typically take someone through an elimination diet first
A
to remove it?
Actually, a lot of people who come to me have already done all the elimination diets. They've already done everything they could possibly do on their own. They may just be reacting to weird foods that they don't know. Like I had a patient who was reacting to Brazil nuts, who
Mm.
had thyroid condition. So, a lot of people would just say, "Oh, have a Brazil nut," but then this patient's reacting, right? So that's
Yeah.
a challenge.
Yeah, that's interesting. It can be hard
Mhm.
too, I think, when, if we have something going on in our gut, like leaky gut, for example, that is making us react to everything, like you said, then yeah, it's such a complicated picture. And it really, like, people can be grasping at straws to try to eliminate more foods and get more and more restricted. So that's great.
Yeah. And then it's sad because then they finally come to me and they're like, I'm just eating like 10 foods. That's all I can eat. When it's actually not true. It's just because they took the test again when their gut's inflamed. So they get
Mm.
all this misinformation and then are reacting from misinformation rather than being like, okay, I know gut's inflamed. I know I'm going to react to everything. So the test is not so accurate. That's why we wait.
Yeah, that's a great way to approach it. I love that.
Yeah.
What would be some other, methods that you like to use or treatments? You mentioned sauna, you mentioned, looking at nutritional aspects and changing the diet. What are other methods that you love to use?
Besides like, yeah, so we do nutrition, sauna, also movement. So I need my patients to be able to put on muscle
Mhm.
for their hormones to function. So we call it training for menopause. So we
Mm.
have to train for menopause. We have to have muscle to actually have healthy hormones. So that is another thing. And then yeah, just diet, movement. I'm trying to think of what else. Sauna. Um, and then I'm a huge believer in also like mental health, like the mental health connection. So I do a lot of hypnotherapy and I use neurolinguistic programming as well. So mainly using a lot of mindset work to get us out of the kind of rat race that got us there in the first place. So usually what will happen is the gut and then the thyroid and then the adrenals are kind of like dominoes. So I use a lot of mindset work to address the a lot of the beliefs when women are like, oh, I have to go, 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 or I can't think about me first. I have to put everybody else before me. So I address a lot of that with my patients.
Great. That's so important. I mean, for women in general, because we tend to, especially our higher achieving women, they're taking on so much. They're maybe managing the household, they're working, they're, so driven in so many different areas of their life. It can be really hard to slow down and realize that that's maybe not the best way to take care of themselves. So that's amazing to have that mindset component. And that's so important too. I mean, I think our hormones in general, you mentioned that domino effect.
Oh
It's really
yeah.
affects hormones also in our reproduction. Our reproduction ends up being the thing to suffer when all of the rest of it is out of balance. So it's really important, I think, to look at that for really all of us, but especially if we're having hormonal imbalances and these other things.
Yeah, so what I do is I, teach my patients about eating regularly because a lot of them when they get to me either don't have a hunger signal anymore in the morning or they say, "Oh, I feel sick in the morning, I can't eat." And then they're just skipping meals or they're eating on the go because they're taking care of everybody else.
Mhm.
So that's a huge thing. And I know there's a huge connection with tradition. I do traditional Chinese medicine as well and acupuncture. So when you're not eating regularly, that also worsens thyroid, also in gut function. But
Mhm.
those are huge things to look at.
Yeah. Yeah. It's so powerful, right? Those pieces of our life that we think we maybe are getting by, like sneaking by with, and they could have this massive impact on everything.
Hmm.
So what are those pieces, say someone who maybe they're not at the place to be able to have one-on-one support with someone, they're not really sure about working with someone. What are some things that they could do, pretty quickly and easily, some like action items that people can take to support their gut health and their thyroid?
I would say definitely eating regularly is a huge one. I even have it like in my phone because you get so busy and you're like going through your day and you're like, did I eat lunch or did I eat breakfast, right? So if you're skipping meals, making sure that you have it in your day to be like, okay, breakfast, lunch, dinner, like I have to actually eat food. And not just like go, 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 just grabbing snacks all day. That's another thing is not grazing throughout the day because you have to actually let your stomach empty before you allow other food in. And then making sure that you're having at least 20 to 30 grams of protein a day is really helpful. That will keep you sustained until the next meal. So for people who are grazing all the time, they're possibly protein deficient or they're not getting enough protein. So that movement, other things that they can do, sauna helps a ton with getting rid of, I'm sure you know this as well, with getting rid of all of those toxins out of your system, because we get rid of those through sweat. So that is helpful, staying hydrated and also getting tons of sleep. So
Yeah.
7 to 8 hours of sleep is ideal.
Awesome. Those pillars of our health, right?
Yes.
The maybe boring things that are just having such a huge impact on our overall day. Yeah, I love that.
Yes. I always say like naps and snacks pretty much save everything.
I love that. I can see that on a bumper sticker. That's
Yes.
yeah, awesome. All right. Any other like, advice that you would give women in general, especially who are maybe concerned about their hormonal health, wondering about their thyroid, gut health? Any other takeaways that you want to share?
I would say to be your own best advocate.
Mm,
So you may feel like something is going on in your body and may kind of not know who to go to, but if you go to a doctor and they dismiss you, I would just say like find another doctor. It's
mm,
always your right to get a second opinion. It's always your right to advocate for yourself. So again, if you're not feeling something's going on or you're not feeling all that great, then definitely find someone in your area or you may have to fly to somebody, but find someone in your area to definitely work with.
yeah, absolutely. Well, where can people find you, Valerie?
They can find me on Instagram at Dr. Valerie Gettings and at on my website at drvaleriegettings.com.
Awesome. Your website is beautiful, by the way.
Oh, thank you so much. Thanks.
Well, thank you so much for being here. I really enjoyed our conversation. I think this will be really helpful for women to hear and learn a little bit more about, what they can do and what things to really look for to best support their health. To the listener, I hope you enjoyed this. If you did, make sure you subscribe so you can follow us along as we do a lot more of these conversations. For the resources that we've mentioned here and to learn more about how to reach Dr. Gettings, you can look at the show notes page for that. All right. Thanks so much.
Thanks so much for having me.